Welcome back. I'm your healthcare advocate, Cary Hall. You're listening to America's Healthcare Advocate Show, broadcasting here on the HIA Radio Network, coast to coast across the fruited plain. My producer, Mr. Steve Largent, my special guest in studio, Dr. Dawnavan Davis, Director of Health Promotions, Blue Cross and Blue Shield of Kansas City. We will be joined in the next segment by Mark Donovan, President of the Kansas City Chiefs as well. If you are interested in a tour, you've got a school, you've got a YMCA, a boys club, whatever the case may be, and you want information on how you can come to the Sports Lab powered by Blue KC, well, here's how you do it. For more info, you go to goarrowhead.com, and you click on tours. That's how you get the information if you'd like to come in. Maybe somebody listening in Trenton, St. Joe, Sedalia, Clinton, Harrisonville, all you folks out there listening on the other stations, if you want to come and take a tour of the Chiefs Sports Lab powered by Blue KC, this is how you do it. Go to the website, goarrowhead.com, click on tours. All right, we left off talking about my lack of knowledge about video games. See, that's when you have this much gray hair, you really don't know much about that. Having said that, there is a great video game component here. Let's talk about that for a minute, Doctor.
Yeah, one of the unique contributions of Blue KC to the Chiefs Sports Lab was the development of this 2-minute drill video game where kids can answer questions related to nutrition and physical activity, and if they respond correctly, they advance up the football field and score. So it's a really nice way of bringing together the sports piece and the health piece.
So it's like the 2-minute drill at the end of a game or the end of a half, and so it mimics that same scenario. And if they get it right, they get to move up the field.
Yeah.
So getting it right would be answering a question of, do you supersize the fries as you go through McDonald's, or do you eat an apple?
Absolutely.
Would that be the kind of something to give
Yeah.
folks some kind of an idea on how that might work? All right, and let's focus a little bit on the lab itself and talk about what all is in here, Doctor.
So we have many exhibits, and I think they all speak to something particularly important about health and wellness. And so there's exhibits about how we might engage in physical activity in a safe manner. There's exhibits to let kids know about portion sizes and some of the power foods that we would say, some of the foods that really speak to giving them more energy and so forth. We've got even exhibits that speak to understanding your heart rate and how to increase your heart rate and what that means for physical fitness.
We know about that because we had the heart machine here going
Absolutely.
Hopefully it's not going to come on in the middle of the broadcast. But
so they really come out of this experience learning a lot about some of the critical issues related to child's health.
So let's go back to this because, you know, in this country, and you see it all the time, there's a current commercial running for a restaurant where there are 4 people in a car and somebody's going down the road and they're talking about a restaurant they're going to go to, and 2 people bail out of the car because they can go to this one particular restaurant and eat until they die. So, you know, in other words, there's nothing, you know, it's how much can I get, how much can I eat? You talked about portion. I mean, why is that important? You know, that's one of the things you focus on. I said supersize the fries. You know, you go to McDonald's, you go to you know, one of these drive-through restaurants. It's how much they always ask you. Can I get you to supersize? Can we go up to a bigger size?
Absolutely.
You're taking a different approach to this, which is that may not always be the right thing to do.
Well, we know it's not always the right thing to do. I think our society in general are used to supersized portions. Our portions have grown tremendously and significantly over the last several decades, and so we're used to seeing portions that are 2 or 3 times the actual serving size recommended.
Are you serious? It's that's the difference, 2 or 3 times the actual
absolutely.
recommended size?
Yes. So part of the education through the lab is equipping kids to understand what is a true portion size and what are some of the foods that you want to not eliminate but minimize your intake of. And that's, you know, I think that's most important, is that we really want to speak to, there's no forbidden foods. We can eat everything in moderation. We just have to be mindful of the quantity of what we're eating.
So you're talking about things like salt, sugar, those kinds of intakes, I'm guessing, correct?
Yep, so sugar and salt, but we're also talking about fat and understanding calories, and just, I think, having a better understanding of what is truly a balanced diet, and that means intaking those pieces in moderation.
So the goals, what are you trying to accomplish here? Blue KC, here in the Chiefs Lab, powered by Blue KC, what are you trying to accomplish in terms of the overall community with this initiative, Doctor?
Well, I think from our perspective, this really speaks to Blue KC's new strategy related to health promotion. It's actually linking with other like-minded, like-missioned organizations that want to create meaningful, impactful programming, and that's what we're all about. So at the end of the day, I think both the Kansas City Chiefs and the Blue KC are committed to doing that. And I think the Chiefs Sports Lab is just one representation of that goal.
You know, it's interesting because that's not what people expect to hear from a health insurance company.
Absolutely.
You're going to the root of the problem. You're going to the cause. You're not putting a Band-Aid over it. This is not, I think, what people expect to hear from health insurance companies. It's certainly a different approach to it. Wouldn't you agree?
I would agree, but I think that, our primary goal and one of our key goals is to be a health and wellness leader. And that's about not just focusing on treatment, but focusing on the major health issues and concerns of our community and our kids. And for us, childhood obesity is something that we really need to impact and reverse. And so we're committed to doing programs like that.
And you're not going to see, you talked about this, that's interesting. You're not going to see a change. You're not going to see the cost of healthcare start to be driven down until those kinds of core issues get addressed. Am I right or wrong?
You're absolutely right. And so, for health promotion, we're really focusing on prevention. And so, yes, there may be downstream implications that we may not see right away, but we know that if we have healthier communities, healthier children, then we have healthier adults, and that's really what we're aiming to do.
So if you want more information, if you'd like an opportunity to come to the Chief Sports Lab powered by Blue KC, you can go to the website, goarrowhead.com. If your school, your club, your boys club, your YMCA, whatever the case may be, if you'd like an opportunity to come to this really great facility, have a good time and learn something, be educated, educate the children in terms of what is good for them, what their responsibilities are, and to take responsibility for themselves and some of the things Dr. Davis talked about, go to the website, goarrowhead.com. It's a beautiful stadium and a great opportunity. Goarrowhead.com. Click on tours, and you can get information about coming to the Chiefs Sports Lab powered by Blue KC. I'll be right back after the break with Mark Dawnavan, president of the Kansas City Chiefs, to continue talking about our experience here today at the Chiefs Sports Lab powered by Blue KC. You're listening to America's Healthcare Advocate, broadcasting on the HIA Radio Network, coast to coast across the USA.